For today's presentation, please submit any questions for Dr. Cooper and our presenters using the chat box feature. We will answer any questions after our presenters speak, as some questions may be answered along the way. Dr. Christopher Cooper will be our moderator for today's conversation. Dr. Cooper earned his medical degree from the University of Cincinnati, where he graduated as class valedictorian. He completed his cardiology residency and fellowship programs at Brigham and Women's Hospital in Boston. Sorry, Dr. Cooper, which is associated with Harvard College of Medicine. Dr. Cooper has been part of the University of Toledo for more than 25 years. In the field of cardiology, he is known across the globe and has received more than 25 million in external funding for his research initiatives. His work has been published in numerous journals such as the New England Journal. I will now turn the meeting over to Dr. Chris Cooper.
Thank you, Susan, and thank you to all of our participants tonight and all of those who are attending. Really glad to have you here. So, hi, I'm Dr. Christopher Cooper, Dean of the College of Medicine and Life Sciences and Executive Vice President at the University of Toledo. As a word of introduction, the College of Medicine and Life Sciences is in the business of discovery through nationally recognized research, patient care, and training of many of our region's physicians, scientists, and other health professionals. The compass that continues to guide us is our mission to improve the health in our communities and in our region. To that end, we believe that there's still great need within our community for reliable, accurate information about the COVID-19 pandemic. I'm really excited about today's panel. We have nationally and regionally recognized leaders that include virologists who work with the COVID-19 and other lethal viruses, infectious disease specialists that are on the front lines of COVID care and lead many of our region's responses. We have a pharmacist who's leading UTMC's efforts to distribute COVID vaccines, and we have special guests joining the panel from the Lucas County Health Department, the Ottawa County Health Department, the Wood County Health Department, and the Monroe County Health Department as well. What our goal is to make sure that you have solid, reliable information that you can trust. And so I'm going to just take a moment to introduce tonight's presenters and panelists. So Dr. Daniel Cadigan has been with the Lucas County Health Department since 2020, serving as medical director. He has a strong interest in healthcare quality and in promoting preventive and social measures to improve community health. Dr. Cadigan has been a primary care physician here in Northwest Ohio for over 25 years, who I've personally had the delight of working with, and he has experience in both rural and urban settings. He earned his bachelor's medical degree and completed residency program at Memorial University in Newfoundland, Canada. Importantly, joining Dr. Cadigan tonight is Katie Crowell, Director of Nursing at Ottawa County Health Department, Ben Robeson, Health Commissioner at the Wood County Health Department, and Dr. Carl Schmidt, Medical Director at the Monroe County Health Department in Monroe, Michigan. We also have with us Dr. Joan Duggan, who's an infectious disease specialist and professor in the Department of Internal Medicine, as well as Senior Associate Dean for Faculty Affairs and Development and Professionalism within the college. She earned her medical degree from MCO and completed an ID fellowship at the University of Michigan. She's had numerous awards, millions in grant funding, and over 130 publications. We're also delighted to have Jason Huntley with us again tonight. He is an associate professor of medical microbiology and immunology here at the university. He's director of our biosafety level 3 lab, which is a specialized high containment lab that allows our research groups to work with deadly bacteria and viruses like the SARS-CoV-2 virus that causes COVID. Interestingly, Dr. Huntley introduced Dr. Anthony Fauci at the National Biothreats Conference in Washington, D.C. And at that meeting, Dr. Fauci last January opened our eyes to the novel and deadly viral pneumonia sweeping through China, what we now know as COVID-19. We also have tonight Dr. Jacob Masajewski, known to his patients as Dr. Jacob. And Dr. Jacob is a 3-time graduate from our university. He went to MCO, the Medical University of Ohio, and the University of Toledo's College of Medicine. He completed his residency training program at the University of Toledo in 2009, at which time he became a fellow of the American Academy of Pediatrics. Currently, he's the section chief of pediatrics at Bay Park and department representative and vice chair of pediatrics at the Russell J. Ebi Children's Hospital at ProMedica. We are also delighted to have Dr. Russ Smith, who's the chief pharmacy officer, quality and safety officer, and administrator at the University of Toledo Medical Center. Russ has more than 25 years of academic pharmacy experience and oversees all clinical pharmacy activities on our campuses. He received his Doctor of Pharmacy degree from the University of Shenandoah, and he is leading our university's COVID immunization program. It's now my pleasure to turn over the presentation to Dr. Jacob. Welcome.
Perfect. Thank you for that introduction, and thanks for inviting me to the town hall. This is my first time joining a town hall meeting. As Dr. Cooper had mentioned, I do pediatrics over at a Bay Park Hospital, Oregon Pediatrics, so much of my talk is going to focus on children. One of the things I look at every day when I wake up is the number of cases of COVID-19 in the United States. Back in early to mid-January, I believe we peaked around 212,000 cases per day. And I checked the Reuters website, COVID tracking for the United States. And over the past week, we've been down below 30,000 cases per day and somewhere around 25,000 cases today. So the numbers continue to decline with all the efforts being made as far as vaccinations go. Particularly for children, as of May 6, 3.9 million children were reported positive for COVID-19. And again, this accounts for children who have been tested positive. The numbers of children infected had gone up for a period of time there. Unfortunately, as adults became vaccinated, children became spreaders of disease and continue to get infected at higher rates. But the week of May 7th to the 13th saw under 49,000 new cases in the United States, which was down from 72,000 the previous week. So we went from 72,000 to 49,000 over the course of a week, which is the lowest number we've seen in children since October 2020. For children overall, they account for about 14% of cases, but the new cases in children had accounted for about 24% of the cases. So still some effort to be done there. The number of deaths is about 308 during the course of the pandemic for children. So speaking for children again, particularly for the vaccine, the American Academy of Pediatrics is our governing body, and they released a new policy statement on COVID-19 vaccines, and it reads as such: vaccines are safe and effective in protecting individuals and populations against diseases. New vaccines are evaluated by a long-standing, rigorous, and transparent process through the FDA and the CDC, by which safety and efficacy data are reviewed prior to authorization and recommendation. The AAP recommends COVID-19 vaccination for all children and adolescents 12 years of age and older who do not have contraindications using a COVID-19 vaccine authorized for their age. Any COVID-19 vaccine authorized through emergency use authorization by the FDA, recommended by the CDC, and appropriate by age and health status can be used for COVID-19 vaccination in children and adolescents. Given the importance of routine vaccination and the need for rapid uptake of COVID-19 vaccines, the AAP supports co-administration of routine childhood and adolescent immunizations with COVID-19 vaccines for children and adolescents who are behind or are due for immunizations or at increased risk from vaccine preventable diseases. This is really important because over the past year and a half, we've had much decreased numbers in children coming in to seek WellCare visits. Currently in the United States, we are down about 1.5 million doses of measles vaccination. With doses like this, we're going to start to lose herd immunity, and we're going to start to see case numbers starting to increase. For all vaccines, we're down about 10 to 25% behind on vaccinations, and adolescents are leading the way in missed vaccinations, so it's important to get them in. So the policy statement clears it up. Previously, the CDC said there's supposed to be 14 days between a COVID vaccine and another vaccine, but now they're saying you can receive them on the same day, you can receive them the day after. We don't want people getting behind on their immunizations. So currently the Pfizer vaccine is the one that is approved for children and adolescents 12 and older. The 16 to 18-year-old age group was approved on December 11th of 2020, and the 12 to 15-year-old age group was just approved May 10th for emergency use authorization. The ACIP, you may hear this on the TV or Good Morning America. This is the Advisory Committee for Immunization Practices. They had a 14-0 unanimous vote to authorize the Pfizer vaccine for children ages 12 and older. So looking at the study for the Pfizer vaccine, they looked at 2,260 adolescents between 12 and 15 years old, where about half were vaccinated and half were placebo. And these participants were followed for 2 months. Among the 1,005 vaccinated adolescents, 0 of the vaccinated adolescents contracted COVID-19. The placebo group, which consisted of 976 recipients, there were 16 positive cases with a reported efficacy of 100%. So far, you may say, well, 2,260 doesn't seem like a lot, but so far over 600,000 12 to 15-year-olds have received a vaccine, and more than 2 million 16 to 18 years old have had at least one dose of the Pfizer vaccine. The most common side effects are similar to what we see in adults: injection site pain, soreness, fatigue, headache, chills, muscle pains, fever, and joint pain. In the adolescents, there were no reported cases of blood clots, serious allergic reactions, or Bell's palsies. 5 serious adverse events were determined to be unrelated to the vaccine, and these were constipation, nerve pain, and suicidal thoughts, depression, anxiety. When you look at things such as nerve pain, suicidal thoughts, depression, anxiety, and even today you may have seen on the news discussion about myocarditis, inflammation of the heart. The reports were that there were a few cases of this possibly reported, but you have to look at the number of cases, for instance, of people with depression, anxiety, suicidal thoughts, or the number of people who develop myocarditis. Is it more in the vaccine group compared to the general population? And currently, for these different conditions, the answer is no. They're still looking into it, and that's just testament to the process working. I can remember a rotavirus vaccine, which is the oral vaccine your children may have received. Rotavirus protects against a bad vomiting diarrheal illness. Back in the 90s, there was one called RotaShield that seemed safe and effective. But once it started to get administered to millions of people, it was associated with a condition called intussusception, which is a bowel disease. So as they continue to follow people over time, they can determine what's associated with the vaccine and what's not. So they'll look into myocarditis, but it does not occur any more frequently, apparently, than in people who have not received the vaccine. Currently, there are tens of thousands of people signed up for phase 3 trials for the Pfizer for ages 5 to 12. And the Moderna vaccine is likely going to be authorized next month for 12 and older. As far as the younger populations, ages 2 and older, the current reports are possibly the fourth quarter or first quarter of 2022. When looking at the younger populations, children are not just small adults. We can't just inject them with the same dose that you give to adults. They have to do de-escalation studies where they give smaller amounts of the medicine, of the vaccine, and determine, are they getting an antibody response, and are they having side effects to make sure the vaccine is safe and effective. Vaccines are very important. Not only do they prevent disease, but it is apparent that they also prevent transmission of the disease. And 2 weeks after you receive a vaccine, you are considered protected. The Pfizer and Moderna vaccines are more than 90% effective 6 months after receiving them. So what are the complications, particularly for the coronavirus, for COVID? Well, one thing you may hear about is long haulers, and we see these in children as well as adults. Long haulers might have mild infections. They could have asymptomatic infections and have these symptoms too. Small numbers of children are reportedly struggling with extreme fatigue, chronic headaches, chronic pain, decreased taste and smell, intermittent rashes, rapid heart rate, memory loss, and depression. Currently, the Rainbow Babies Children's Hospital in Cleveland is opening the first long haulers clinic for children in Cleveland. The other side effect you may have seen is MIS-C, multi-system inflammatory syndrome in children. and there have been over 3,007 cases reported of this. Most of these cases occur between the ages of 5 and 14, and there have been several dozen deaths reported from MISC as well. Other complications are just the social, physical, and emotional toll that children and adolescents have had during this pandemic. Initially, children were mostly at home, quarantined, isolated from friends, not going to school. So not only are there side effects such as long haulers, inflammatory disorders, but it also takes a mental toll as well. The long-term effects of COVID in children are not truly known. However, there appears to be no long-term effects in those who are vaccinated. Currently, of all the vaccines that are out there for people, vaccine side effects occur within 6 weeks after receiving your vaccine. Vaccines don't cause side effects years down the road. So when people are studied for a couple of months for the vaccines, we are anticipating the side effects are going to be seen. So that's a common question we get. Well, we don't know the long-term side effects. Well, the current knowledge and fund of data we have is that vaccines do not cause long-term side effects. So what are the contraindications? Pretty much the same as adults. If you're allergic to any of the ingredients in there or had an allergic reaction to a previous vaccine, you should not receive it. The primary lipid, the fatty molecule in there is polyethylene glycol, which is found in Miralax. What are the myths about the vaccine? There's no evidence it can cause any impact on fertility. Thousands of pregnancies have come to fruition after the advent of the vaccine. The other thing that some of the parents might see or talk to your adolescents is TikTok. There are people on there who are posting videos of themselves sticking magnets to their arm to demonstrate that there's a microchip under their arm, which is completely false, ridiculous that people are putting this out there. You may have seen as well that the CDC has updated their mask guidance. This is for people who are vaccinated. Children under the age of 12 need to continue to take the same precautions that you guys were all taking before you were vaccinated. Children not vaccinated are still at risk of exposure, particularly in public places. Children should continue wearing masks when in public places. Children don't need masks when with a family member from the same household or at a small gathering with fully vaccinated family members and friends. The CDC says vaccinated people can socialize indoors with one other household of unvaccinated people. So what does this mean? Essentially, your children are going to be seeing other children this summer. They may have play dates. They may go to the park, the pool, and things such as this. There's discussion of people grouping in pods, people who you might be closest with, people who you can trust, because really it comes down to what's your tolerance for risk and how much do you trust the people around you? Is the person you're out with, are they going to let you know if they just came from a large birthday party where people were unmasked? Did people just come from Cedar Point, maybe, where they're around large groups of people? So who you're hanging out with and are the people vaccinated should make help you make a decision on who it's safe to be around. Questions we get also are regarding to attending summer camps, going to the beach, going to the pool, and playing sports. You know, the guidance for camps was updated most recently on April 24th, and the CDC has a very, very thorough page dedicated to helping camps keep their campers safe. It's encouraging vaccination for those who are eligible, wearing masks at all times, distancing, cohorting of individuals, hand washing, testing for people staying longer than a week at a camp or for overnight camps, camp testing during the camp as well. So when you're looking at these types of things, it's important to talk to the camp and see if they're following CDC guidance for your child going to that camp. As far as going to a pool and a beach, some of this comes down to common sense. If you're going to a beach or to a pool and the place is absolutely packed, it's probably not a good place for you to be. If you're going to a pool at a family's friend, few people are there, people are vaccinated, they're within your pod, people are distanced, that's probably a much safer case for you. The recommendations for return to sports have not really changed much since December when the CDC posted their guidance. Outdoor sports are much safer than indoor sports. Masking when you are not able to keep distance, such as hanging out in a dugout at a baseball game, is going to be a higher risk at a baseball game as opposed to soccer where kids are spread out. And we may be able to address some of these questions a little bit more or during the Q&A session. But with that being said, I'm going to turn it over to Dr. Huntley at this time.
Okay, thank you, Jacob. That was, I think, really helpful information for a lot of us, including myself, who's a parent. So just real briefly, hello, everyone. I'm Jason Huntley. I'd like to talk briefly about some new information about the variants, the SARS-CoV-2 variants, and then what's coming up in vaccines. So last time we met in about mid-March, and you can see on this graph, March 13th, about 25% of the isolates here in the US were the UK variant, or the B117. If you look over now on May 8th, you can see how the UK variant is now about 2/3 of the isolates that are detected here in the US. So again, this was predicted. This is the major variant that's present. Why this is important, when that variant was first, isolated, and there were some studies on it, especially in the UK, it was reported as about 50% more transmissible, and therefore perhaps more likely to cause disease. With vaccination and with mask wearing and social distancing, we certainly see numbers going down. What I've highlighted on this data from the CDC, however, what we really have to worry about are these new variants coming out of India, the B1617. In fact, there's at least 4 different variants that are reported to be 50% more transmissible than the UK variant. However, data from Pfizer and Moderna both indicate that their vaccines have induced antibodies that offer you very high levels of protection, even against these Indian variants, which again, right now, and we're about 2 to 3 weeks behind on data, but right now, although they're low prevalence, they're probably going to increase and become the major variants here in the US just because of their transmissibility. So here's where we are. Next slide. So we've had a bunch of questions since the last time about, will I have to get a COVID booster vaccine? The simple answer is, if you've seen, Dr. Fauci or heard other experts, the simple answer is we don't know. Pfizer and Moderna are currently doing clinical trials testing booster vaccines to cover variants, including the UK variant. It's too late now to include the Indian variants, but that may be coming down the road. Johnson & Johnson, the 1-dose vaccine, they've noted that they're starting to think about planning booster vaccines. Here's what we know. Both the Pfizer and the Moderna clinical trials ended in August, September. So we're approximately 8 to 9 months after thousands and thousands of people received both of those vaccines. And they continue to follow those people, and those antibodies last for greater than 6 months. Again, for those people in the clinical trials, they're pushing 8 or 9 months. So the simple answer is, it's too early to know if we'll need boosters, but based on the people who got the clinical trials, when their antibody titers start to decrease, or when they don't protect against the new variants, there is a plan to roll out boosters. Again, it's too early, but we'll wait and see. There are plans. Next slide, please. And then Jacob already covered this. Again, this is just highlighting that, we currently have vaccines against 12 and older. You heard this morning that Pfizer is going to ask for emergency use authorization for their vaccine to be administered to 12 and older. And then we're hoping for immunization and perhaps emergency use authorization from Pfizer from 2 to 12-year-olds by September, for up to 6 months old and older by December. So that's my last slide. And now I'd like to pass it off to Dr. Cadigan and our Department of Health panel.
Hi, good evening. Once again, thank you to the University of Toledo for having those of us from the regional health departments on board this evening. As we work our way through vaccination for COVID-19, certainly this is a regional issue, and we have representatives from the 4 regional health departments here today, just to kind of give an update on what's going on in our areas. I'll speak as medical director of Lucas County Health Department. We presently right now have approximately 45% of the Lucas County population that's completed a first dose of vaccine, and about 40% of the Lucas County population has had the completed series. We're seeing a drop overall in the number of cases on average per day, number of positive tests. On a 14-day running average, in the last 14 days down to about 40 positives per day over the 14 days from 70 a few weeks ago. And our latest statistics showed we were running at about 10 per 100,000 population, which is heading in the direction of where we want to be with kind of 3 or positives or so or under. We've taken a variety of approaches before the $1 million vaccine lottery came in that TARDA has outfitted a bus along with the V Project, and we've been able to move vaccine into sites within neighborhoods, particularly neighborhoods with low uptake of vaccination, which has been quite successful. As Dr. Cooper mentioned, there have been some unusual things. We've partnered with at least one local brewery. After you had your vaccination, you had a free beer. We've gotten vaccines into the hands of our fire and EMS so that they can go out into neighborhoods and try to bring the vaccine directly to the people. And we've held some vaccination clinics actually within the city parks as well, so that people can just walk up. And I know some of the other counties regionally have had similar processes in place. The positive we've seen is that even with the short period of time that the vaccination's been available for the teenage age group, where our statistics are showing about a 10% rate of vaccination already from the up to 19 years of age, which I feel is quite significant given that it's only been a couple of weeks that vaccination's been available. And the other positive, certainly in terms of the higher risk population, is that approximately 80% of the 65 and older age group have been vaccinated against COVID-19. We're working on higher risk populations. African-American, Latino communities within Lucas County, we're presently running at about 30%, but again, significant efforts are being made to bring those out. It's great to have colleagues on board today because, as I say, we can't operate in a silo for this. People commute to and from each county surrounding Lucas County, and it's important that we approach this regionally. We can't vaccinate within one county and then have somebody going elsewhere where there's low rates of vaccination. And I know Dr. Robeson is the commissioner in Wood County. Ben Robeson has been commissioner, I believe, since last year. Grew up in Bowling Green, graduated from BG High School, to my understanding, and also BG, and has worked in emergency preparedness and public health before taking the Wood County Commissioner position last year. And I know each of my colleagues in these other departments, as I introduced them, have some statistics for their own area. And I know Mr. Robinson as well was going to certainly emphasize, what he feels is important in terms of the benefits as a community we get through vaccination, not just as an individual. So having said that, Ben, since your camera's on, I'm going to turn things over to you.
Thanks, Dr. Cadigan. Appreciate the introduction as well. So that's true. I joined the Wood County Health Department on September 2nd. Before that, I'd worked at the Ohio Department of Health for the previous 5 years, and had an opportunity to return back to my home community. I didn't expect I would do this in the middle of a pandemic, but there's a lot of things that have happened in this pandemic that were unexpected, and this is certainly not the largest of those surprises. So happy to be back here in Northwest Ohio. It's fun to be here with my family and to begin to let them see the things that I experienced growing up here in the community. So here in Wood County, we've noticed that one of the most important things is really trying to make vaccine available in smaller numbers as the demand has changed and how we've approached this. If I go back to the end of March, we had 2 really big clinics that, in partnership with Bowling Green State University, we administered nearly 5,000 vaccines in 2 days. Fast forward a couple of weeks, and we went from having every appointment filled every week to only being able to fill in advance about 150 of our 1,500 appointments that we had made available. And so it's a pretty substantially different environment that we are in now than where we were when we started the vaccine campaign. What we've been doing is really trying to make vaccine available in reliable ways throughout our county. And we're doing that because there's quite a bit of difference in terms of our vaccine uptake from zip code to zip code. And when we look at our zip codes and we look at our eligible population, on the low end, our lowest rate of uptake among our zip codes is about 20% on the low end, and the highest is just under 75%. So that's looking at all the individuals who are aged 12 years old and older and able to be vaccinated. And so 20% on the low end have taken it in one zip code, and on the other end, about just under 75% have taken it. And so when we look at these numbers, the reason why that matters to us is that as we've been focusing up until now, it's been focused on getting people with the greatest risk for severe outcomes to be vaccinated. And so in Wood County, very much like other counties throughout the state, about 90% of the deaths that have occurred in individuals who are 65 years old or older. And more than half of the hospitalizations have been in that same age group. Well, now they've been able to get those individuals largely vaccinated. Nearly 90% of our 65 years, people who are 65 years old and older have at least started their vaccine series. And so that's really substantially reduced the impact on our communities. And we've been encouraged by that. But as we look at the possibility of getting fully beyond this pandemic, we want to not only protect people themselves individually, but also prevent the spread of the disease within our community at large. That is essentially what herd immunity means. Herd immunity means that someone who is not vaccinated against COVID will be protected against COVID because there are enough people that are not likely to develop disease that now they prevent the spread of that disease in a sustained way from person to person. So when we talk about, protection for yourself against COVID with these vaccines, we have really good efficacy studies on Pfizer and Moderna using real world data. And those studies found that among healthcare workers who were being exposed to COVID more often than most of us are in the general community, that they had about 90% efficacy or effectiveness against the vaccine in real world studies. This was about 35 times more, lower rate of disease transmission than what we saw among same situated individuals who were not vaccinated. And so when you think about that 90% number, you think, well, that's good enough, right? So if someone wants to be protected, they can be protected by vaccinating themselves, and that's true. And they are going to be protected not only against developing the disease at all, but in many cases against severe disease as well. But where we get substantial, cumulative benefit is when now we are vaccinating not just one generation, but 2 and 3 generations against COVID. So now, if I'm vaccinated and my neighbor is vaccinated and one of us is exposed to COVID, the chance of the person exposed to developing disease is about 1 in 10, right? Just about 10%. Well, the chance of me being exposed to them, should they develop disease and then also developing disease, is only 10% of their 10%. Or 1%. So you can see that just by adding these two things together, we get a cumulative benefit for vaccine just by getting by building on those benefits across our community. And so that's really the important goal that we have here is by trying to get as many of our members of our community vaccinated as possible, it can help to really slow the spread of disease. And what we're learning from new information from the CDC is that a fully vaccinated individual is not only likely to be protected against disease should they encounter it in the real world, but they're also less likely to spread it asymptomatically. And that's really important too. So some of this mass guidance that we're hearing now is reflective of some of this new understanding that we've learned. And as we continue to build our vaccine levels, that will help us substantially. So I want to pass it now to my colleague in Ottawa County to keep this going. I think, as we think about the benefits of vaccine, I think from a community level, I think there's opportunities for us to continue to take a community approach. And as your public health departments, we want to be a part of that fight. And we thank you for joining with us as we continue to grow our vaccine opportunities and protect not only those individuals, but individuals in our community who can't be vaccinated yet.
I'd like to introduce, thank you, Ben. I'd like to introduce Katie. Katie Crowell is the Director of Nursing with the Ottawa County Health Department. Katie is a registered nurse and has a master's in public health from the University of Toledo. She's been with the Ottawa County Health Department as DON since July of last year and has been part of their COVID response team, has been involved in public education efforts for COVID vaccination and coordinated the vaccine clinics throughout the county, which have been highly successful in terms of increasing vaccination rates in Ottawa County. She definitely has a strong emphasis on education, and I know she was going to give us some Ottawa County statistics and kind of talk about what we should be looking at doing going forth from here.
Thank you, Dr. Cadigan. As he said, I've been with the Ottawa County Health Department for a few years now, but I recently took over as Director of Nursing as of July 1, 2020. So in the middle of the pandemic, just like my counterpart in Wood County, we both came in during an exciting time. So in Ottawa County, we have seen, we have almost 50%, just shy of 50% of our population that has started their vaccine. And then we have just shy of 45% that have completed their vaccine. And that is incredibly encouraging. We have had an amazing turnout at our clinics since the beginning. We've had fantastic community support, and our community partners have really rallied behind us, and we wouldn't be able to do it without them. We have some interesting challenges in our county because we are a very long and narrow county, and we have a lot of ground to cover as far as getting to different places in the county to hold vaccine clinics. So we have been partnering with different agencies within the county. Camp Perry has been an amazing location for us to use. We also teamed up with Job and Family Services, and we have the Erie Islands to also contend with. So we actually, during the winter, we're flying over to Put-in-Bay in order to vaccinate people that live on the islands year round. We've also, that's where I was at today. We were vaccinating at Put-in-Bay again today, and it's something that we can take to them. There's a lot of logistics that come with living on an island, and so we thought that it would be best if we could just take everything to them, really help them out, and that has been a fantastic turnout. And we've really seen a decrease in our COVID cases. There's been a few days lately where we've had no reported COVID cases, which is amazing to hear. It gives us great hope. But with that being said, there is a lot of our population that has not been vaccinated, and there's a lot of people, we're a tourist community, so there's a lot of people that come in to our community that haven't been vaccinated. So we're really trying to encourage those that can get vaccinated to be vaccinated. With the vaccination age decreasing, we've also been able to go out to the local schools and vaccinate within the schools. We had a community partner that recently donated tickets for a free round of putt-putt, or you can take $4 off of a family fun pack. And that's just a fun incentive for families to come out, get vaccinated, and then they can go do a fun activity afterwards or sometime this summer. And so we're encouraging people to be healthy, get outdoors, experience life again. And that's something that we're all excited about, but also to be cautious. We still want to do things like monitoring yourself for signs and symptoms. If you are feeling under the weather, it's okay. You can stay home. You don't need to go to that big family gathering that you wanted to go to. We also want to still encourage hand hygiene. That is always incredibly important. And again, if you can get vaccinated, please do so. We also want to emphasize that, you know, the masks are effective. And if you do go to a business such as a healthcare facility, just be mindful that they still might ask you to wear a mask. You know, they're in the business of taking care of those that are ill. So we want to remind everybody that while we are seeing an increase of vaccinations, and this is super encouraging, we still want people to take precautions. As Dr. Jacob had mentioned before, at large family gatherings or any gatherings of that matter, please be cautious of those around you, things of that nature. So I will turn that back over to Dr. Cadigan so he can introduce our next panelist.
Thank you so much, Katie.
Yeah.
Dr. Carl Schmidt is our colleague from north of the border, not my homeland, Canada, north of the border, but north of the contested border between Ohio and Michigan. Dr. Schmidt is Monroe County Medical Director for the Health Department. Also has had an interesting sidebar as a former counter coroner myself. He is a medical examiner for Monroe County and deputy medical examiner, my understanding, for Wayne County. And that's obviously given him some interesting perspective in terms of, we look at asymptomatic spread and what they were seeing through the medical examiner's office last year. And I know Dr. Smith has some thoughts on that, and also some thoughts regarding, the safety in terms of vaccinations as we move forward. So I turn it over to Dr. Carl Smith.
Monroe County is a little strange in the sense that it has a very large transient population. A lot of people who live in Monroe actually work in Toledo and in southern Wayne County. Many of them also work in Ann Arbor and Washtenaw County. So keeping track of who's where has not been easy. But to put it in perspective, we have about 150,000 population in Monroe County. At the peak of the pandemic this year, we had 252 cases on April 12th, and now that's down to 12 daily cases. Our test positivity rate is about 7%, whereas at one point it was close to 20%. As far as deaths go, we've had 258 deaths in Monroe County. The problem with actually counting those deaths is that there is only one hospital in Monroe, which is in the city of Monroe. So some of those deaths happened in Toledo, some of them happened in southern Wayne County, some of them happened in Ann Arbor. So the number of deaths is probably higher than has been officially reported. As far as vaccinations go, we have about 35% of the population that has gotten at least one shot. We have 30% of the population that has been fully vaccinated. We have a tremendous disparity in vaccination rates from zip code to zip code. So there are some zip codes where 70 to 80% of the population is now vaccinated, and there's some where less than 20% of the population has been vaccinated. So I encourage everyone who hasn't been vaccinated to please do. There's a paper that appeared recently looking at vaccination rates in nursing homes. And in those nursing homes that had high vaccination rates, not only were the residents protected and didn't actually have severe disease, but it also protected those residents who had not yet been vaccinated for whatever reason. And it has essentially tamped down on disease that was spreading like wildfire through congregate care facilities, which was apparent in the middle of the pandemic. As far as my main work, which is forensic pathology, which I suppose you can consider is the goth version of primary care. Early in the pandemic, we started a swabbing program in our casework so that we were swabbing 10 to 15 people every day. And there were several reasons for that. One is that aside from not having any idea how many community deaths were actually happening due to COVID-19, remember that most of these deaths were actually in the hospital setting. I think that 95% of these deaths actually occurred in a hospital setting. But we had no idea of what was that percentage at the time. So we started doing routine swabbing, and it also had to do with the safety of the people working in our office, because not knowing what you were dealing with means that you really didn't know exactly what kind of protective gear you needed. And we have followed standard precautions the whole time. And actually, no one has gotten sick in our office from doing this case. But what we discovered was that a significant number of cases that came in for other reasons, accidents, homicides, natural disease, that tested COVID positive didn't actually have the disease. So many people who became infected with the virus and were potentially spreading it, whether either asymptomatic or were minimally symptomatic, and actually died from other things. And the other thing that we discovered was that as far as community deaths go, there were very few community deaths due to COVID-19. And they all had similar characteristics. Most of those deaths, if not all of them, were in fairly obese individuals, BMIs above 30. And from the moment they became symptomatic to the moment that they died, only a short time elapsed. And of course, at that time, none were vaccinated. As far as vaccination and complications go, I can tell you that up to this point, we have had no reported deaths due to vaccination. There have been some reactions during vaccination in Wayne County as well as Monroe County, mainly in those people who had a history of allergy. And I think that's kind of important that other than that background of having had some allergic reaction in the past, there have been no complications from the vaccine. So I encourage everybody to get vaccinated. It is for your protection as well as for that of the community. And there really is no safer vaccine that I can think of than the vaccines against COVID-19. And with that, I finished.
Thank you, Dr. Schmidt. I know in the interest of time, we'll get things turned back over to Dr. Duggan, who I'm sure has a lot for us to deal with.
Great. So I have a whole bunch of questions that we've received in the pre-registration, also in the chat, and I'm going to tackle two of them myself. But basically, one of the main questions that people have been asking about are visiting grandma and grandpa and our loved ones this summer, and traveling, and schools reopening. So let me ask our panelists to weigh in from our county health departments, and also Dr. Jacob, our pediatrician. If your family's been vaccinated and everybody's 12 and older, is it okay to travel to see grandma and grandpa? Is it safe? What if grandma and grandpa live overseas? What are your recommendations? So I'll let anybody jump in to tackle that. Dr. Jacob, we're going to start with you first.
Thanks, Dr. Duggan. I appreciate it. I was working on unmuting my my computer there. No, I think that's a great question. It boils down to two different things. You know, who's vaccinated and who's not. You know, if you are vaccinated, your children are 12 and older and they're vaccinated, and the grandparents are vaccinated, by all means, go get together, give them a hug, go visit them, tell them they love you. They need to see that. The grandparents need it, and the kids need it too. Then the other instance applies then. You know, if you have parents who are vaccinated and you have a 5-year-old and they're going to see grandma and grandpa who are vaccinated, again, by all means, go see grandma and grandpa. Just make sure that your child is healthy. Make sure they currently don't have cold symptoms within the past 2 weeks. Make sure they're not had any fevers. Make sure they've not been exposed to anybody who's been around coronavirus. You know, you don't want to go to the birthday party at Chuck E. Cheese and the next day go visit grandma and grandpa, regardless if they're vaccinated or not. So some of it comes down to common sense, but we do need to get to some kind of return to normalcy. And seeing people who are vaccinated is absolutely okay. As far as overseas guidance, you know, there are recommendations for flying overseas, and you know, if you have to get tested before, after you leave, or when you come back, and I'll leave that for referencing, you know, the CDC's website for that part.
So to our public health department people, a lot of people ask questions now about, can I travel overseas? What's the best way to find out what countries are issuing warnings or not? What's the best way to plan for overseas travel and then safely return?
Well, there certainly is guidance from the CDC, as Dr. Jacob indicated. One of the things the CDC notes is that if you are fully vaccinated, you may be able to bypass the testing and quarantine requirements on your way back into the country. That may not necessarily be the same depending on which country you're visiting itself. So that's something to be aware of. And I think starting there is a good way to gather that information. That way you can break it down by individual country. There are some other good things to always do. Check your local health department, depending on where you're going, about any travel vaccinations that might be important, not just COVID, but others as well. And then you can also, if you're going to be traveling overseas, consider registering with the Department of State. The U.S. Department of State, they have great information on a number of things that are happening in the country you're visiting, and they can also help to connect you to resources should something happen unexpectedly. So think universally, not just health precautions, but also other precautions. You'll have a safe and a very successful trip.
And I want to put my ID hat on and also say that, remember, things are spinning on a dime. So a great example of this was if you were actually planning on going to Japan for the Olympics, things may change. And you need to really keep abreast on it. The CDC does keep this up to date and is an excellent website for information on this. So you need to be prepared to spin on a dime if you're planning on traveling overseas this summer. Dr. Cooper, I'm going to ask you to briefly go into some of our updates for our university community, including some of our changes that the Provost office has been rolling out. What can we expect for people in our university community?
Yeah, Joan, great question and an important topic. So guidance was sent out, I believe it was about the mid part of last week, so just about a week ago. And I'll try to summarize it as best I can. So first off, if you're fully vaccinated, which means you've had either the one-shot J&J or both doses of the messenger RNA vaccines, and you're 2 weeks after your vaccination, you no longer are required to wear a mask on campus and do not need to physically distance. This applies both indoors and outdoors and goes into effect a week from tomorrow, so Wednesday, June 2nd. So again, today you have to wear a mask. Today you have to socially distance, but as of next week, if you're fully vaccinated, we're going to lift those restrictions. Secondly, if you've not been fully vaccinated, you should continue to follow the advisories, which means 3-foot social distancing in the classroom, 6 foot elsewhere, wear a mask when you're around other people. Finally, we've had this event registry to keep track of groups and know who's going where and to require certain things. As of June 2nd, we will be discontinuing the event registry and we'll also discontinue the restriction on group gatherings by size. So, currently you can't have a group of more than 100 people. That is eliminated as of June 2nd. Is that helpful, Joan?
That was very helpful. Russ Smith, I'm going to pick on you next. So we hear all of these things that are rolling out every now and then, myocarditis, cavernous vein thrombosis, and it causes people concern. Where should people turn for accurate information on vaccine side effects? Where's the best source of truth for this for people who want to keep up on Moderna, Pfizer, and J&J, especially as they're starting to roll out additional studies?
Great question, Dr. Duggan. So my favorite website to go to is the CDC. Anytime you're going to look for information on these vaccines, going to the CDC, going to your health department website, but then also just encouraging individuals to talk to their healthcare professionals, talking to your physician and your pharmacist to obtain information about your vaccine, about any of your health problems.
Thank you. So this one I'm gonna tackle, and then I'm gonna ask everybody else to weigh in on it, and I'm keeping an eye on the time as well. There's a variety of questions we got asked multiple times, both in pre-registration and twice on the chat. Basically, how safe are the mRNA vaccines for humans? How long have they been studied? It's all so new. What information do we have about this? So one thing I want to point out, which is something I don't think we emphasize enough, the technology for mRNA vaccines was originally reported by Dr. Salk in 1989. He did the Salk vaccine. So we've been working with this technology since the 1980s, okay? These mRNA vaccines against cancer and infectious diseases have been in production for decades now. We actually have some good clinical data on the mRNA vaccines against rabies, Zika, and HIV, especially in terms of safety. mRNA drug technology against cancer. So we know a lot about mRNA vaccines, not necessarily against COVID, but we know that there's quite a bit of safety in the technology. This isn't something that just brand new came out of the blue in the year 2020 in March. This is one of the reasons why it's so extremely important to keep funding the sciences, because it's these things that upon which we grow when we use the technology. So I'm going to turn it over to Dr. Huntley in a second to add a word about mRNA vaccines, and the technology, and also same thing's true about adenovirus vaccines. They've been used in clinical trials for HIV studies, but we have a lot of data on these, not for COVID specifically, but in other venues. They are quite safe. There's no long-term effects. We've been using them in cancer trials for people with metastatic cancer. And I'll turn it over to Dr. Huntley for additional words, but this is not brand new technology. This is just a very new, novel, and hugely wide-scale use of these technologies.
Yeah, thanks, Dr. Duggan. I completely agree. And just to put numbers on it, in addition to them being around for 30 or 40 years, currently we have 164 million people in the US alone who've gotten at least one dose, at least 130 million who've been fully vaccinated 2 doses. So if you're worried about a numbers game and safety, I mean, the numbers are amazing, right? And we have, as we've reported previously in this town hall, that adverse reporting system through the CDC. Believe me, with social media and with the clarity that the CDC has provided, as well as the FDA, if there are serious problems, we would hear about it. Yes, you hear about some adverse reactions, but as Dr. Jacobs said, there's adverse reactions from getting out of bed every morning, from taking a shower, right? There's a complication with living every day, and the risks of just living are about the same as getting one of the approved COVID vaccines. So they're safe, they're effective, and the risks of getting COVID and the serious complications from that are far, far, far worse than any potential risk of getting these mRNA vaccines. Thanks.
And last question, I've had naturally occurring COVID. Why do I need the vaccine? So that's being looked at very, very closely. You do get naturally occurring immunity, probably has activity against the variants. Nice study in JAMA looking at that, probably naturally occurring and vaccine give you studies against the variants. It looks like people who've been vaccinated are less likely to get reinfected than people who have had naturally occurring infections. So the jury's still out on this, but we think that we know it's safe, and we think it's a very good idea to get the vaccine. No, you can wait at the worst 3 months after you've had naturally occurring COVID, but you should get vaccinated. We think it's going to protect you more than naturally occurring vaccine. Finally, before I turn it back over to Dr. Cooper, any last words from the panelists to our audience? My last word is going to be wash your hands. Anybody else? Any words of wisdom before I let Dr. Cooper close us out?
Dr. Duggan, if I could, thank you everybody for being here tonight, and the panelists for inviting me. The 2 things I want to leave with are, number 1, if your child has had COVID-19 and is going to be playing a sport, please get in for a health physical to see and to obtain clearance to return to that sport. A lot of times we just require within the past year to have a checkup. You send your form in, we sign off on it, but somebody needs to go over the history, what happened during the illness, and somebody needs to put a stethoscope on your child's heart, and they need to clear them to return to play. Very, very important. Number 2, when we talk about going to the pool, the beach, camps, return to school, go to cdc.gov, click on learn more about COVID, scroll to the bottom of the page, and click on school and child care programs. And there's a lot of drop-down menus, and you're going to find everything you need to know to keep your child safe this summer. Thank you.
Boy, I think our next town hall is going to be safely returning to school for the kids. We'll have to get a cardiologist on. And with that, I'll turn it over to Dr. Cooper.
Well, look, I really want to express my most sincere appreciation to all the panelists. A few of you have been on these repeatedly, Dr. Huntley, Dr. Duggan, Dr. Smith, Dr. Cadigan. Some of you have just joined tonight, our leadership from the county health departments. I think this has been really helpful perspective. For the audience, what I would say is that, you know, get vaccinated seems to be the punchline. It keeps you safe. It keeps your children, your friends, your family, your parents, your loved ones safe. It keeps our community safe. So let's keep that in perspective, and it'll help us reopen our communities fully. So again, thank you so much. And I'm sure there'll be more information that we'll need to share in the coming months. Thanks so much. Bye-bye.